Hello and welcome, my friends. I'm here to share with you a very interesting topic today, which is about case taking. Case taking is a very practical and important part of philosophy, and I'll be sharing with you the practical parts which is important in relation to the patient and how can you implement that in your daily clinical practice. I've shared with you a few topics on philosophy previously about dispensing, about repetition, which are practically related with the organon, and here I present to you another important part of the practical aspects of case taking. Many times you'll have opportunities to implement this in practice, and especially for newcomers, even seasoned practitioners. Sometimes we tend to forget our basics, or there's a layer of dust on our basics over time, and I'm here to refresh you with examples and excerpts from the organon. If you have the organon, which is the 5th and 6th edition combined, and I'll be sharing with you a few important sections from that. Case taking in the organon is section 83 to 104. This is the practical area of case taking and its analysis. So 83 to 104 deals exclusively with case taking. I'll share with you some of the practical examples from the organon. Section 84. The patient details the history of his suffering. Those about him tell him what they have heard him complain of, how he has behaved, and what they have noticed in him. So you ask about the patient's own expression, own symptoms, subjective symptoms. You ask what his friends, family have heard about him. Those are the objective symptoms. So you have to hear out the subjective as well as objective symptoms. The physician sees, hears, and remarks by his other senses what is of an unusual character about him. The physician himself has to observe, the physician himself has to analyze what is wrong about the patient. I'll come to that physician's analysis later on as well. He writes down accurately all that the patients and his friends have told him in the very expressions used by them. This is very important. Whenever you're analyzing a case, make sure you write down in the patient's own expression. Remember, our materia medica consists of language of simple people and simple language. So they have to match. You have to match the language of materia medica with the language of the patient. So always note down what the patient has to say in his own expression. Do not use your understanding of medical science and put in diagnosis and put in medical words, but simple language of simple people. Keeping silence himself, he allows them to say all they have to say and refrains from interrupting them. So you have to keep silent yourself. Let the patient say what they have to say, and you do not interrupt them at all, so that any interruption will break the train of thought of the narrators. You have to ask the patient to speak slowly. The physician advises them at the beginning of the examination to speak slowly, so that he may take in down writing the important parts of what the speaker say. So you have to ask the patient, speak slowly, so that I can note down what you have to say. Now, few additions to this which I'd like to add is, as I shared earlier on, this is from Different Ways of Finding a Remedy, Margaret Tyler, wonderful book by Margaret Tyler, name of the book, Different Ways of Finding a Remedy. And M.L. Tyler mentions there that, as I mentioned earlier, materia medica consists of statements of simple people in simple language. So they have to match. So always write down the patient's statements in his own words. This is one of the very big mistakes which people may, medical practitioners who have converted to homeopathy, they also make it because they write it in the medical language terms, which is a misconcept. So that's also very important to remember. Another example, Elizabeth Wright, know the patient. Dr. Elizabeth Wright, know the patient. Another very important word, that always ask the patient to speak of their own. Whenever the patient has come to a full stop, you ask, what else? What else? I do follow this question quite a lot. What else? Drain the patient dry of what they know of themselves. So ask, what else? What else? So that they speak more and more about themselves. And always, as I mentioned, drain the patient dry of what they know of themselves. This is Elizabeth Wright, know the patient. So 84 is a very important section, and please do always follow, at least keeping quiet, let the patient speak. B, always make sure that you write it in the patient's own expression rather than your medical science understanding. For example, the patient is saying that I'm having pain in the right abdomen, and you know it's the appendicular region. So you're writing pain in the right appendicular region. So that's not what the patient said. Patient said, I'm having pain in the right side of the lower abdomen, right in the patient's own language. And then later on, you can always go back and do a therapeutic diagnosis, you can do a pathologic diagnosis later on, but always write in the exact expressions of the patient so that you can match it with the symptoms of the Metromedica. Section 85, begin a fresh line with every new circumstance. So whenever you're writing the case taking, whenever you're doing the case notes, always keep some gap in between so that you can always go back and add if something has been missed. Because again, I'm coming back to 85, so that all the symptoms shall be arranged separately, one below the other. He can add to anyone that may have been related in too vague a manner, but subsequently more explicitly explained. So it was mentioned vaguely earlier on, but then explained, so you can add on it. So always keep spaces when you're doing the case taking. Section 86 is another important factor. When the narrators have finished what they would say of their own accord, physician reverts to each particular symptom, elicits more precise information regarding them. So 86 is that you have to give precise information. Now, when do you mean by precise information? That patient has come to you for the joint pain or a headache. Always Hahnemann mentions that you have to complete it with location, sensation, modality, and concomitant. So these are the four pillars of asking the questions to the patient, or asking or framing or completing a particular symptom: location, sensation, modality, concomitant. These four constitute the complete symptom. And many times what happens, you have to add few things to that: the cause, what is the causation, onset, how it started, duration, how long it has been there, and treatment which has received in the past. So location, sensation, modality, concomitant, obviously that makes a complete symptom, but you have to add to it with cause, onset, duration, treatment. Now whenever you are asking about the cause, I will come to that later on, that's also another very important factor about case taking. So 86, again you see, if you look in the third or fourth line of section 86, example, at what period did the symptom occur? Was it previous to taking the medicine, or while taking the medicine, after some days of leaving off the medicine? What kind of pain? What sensation? So location, sensation, modality, concomitant, duration. You have to understand the chronicity, the acuteness of the condition. So always complete it, every symptom, with location, sensation, modality, concomitant, and cause and onset, duration, and treatment, which is an important factor. Now we come to 87. 87 is another very important section, because 87 is dealing with leading questions. So section 87 deals with leading questions. Thus the physician obtains more precise information respecting each particular detail, but without ever framing his questions so as to suggest the answer to the patient. You cannot ask leading questions. You cannot frame your questions so as to suggest the answer to the patient, because many times from that, if you see the last line, a false picture of the disease, unsuitable mode of treatment may result. Now, there's another wonderful read by Dr. Pierre Schmidt. The name of the book is The Art of Interrogation. Dr. Pierre Schmidt, The Art of Interrogation. And there Pierre Schmidt mentions that you have to avoid three types of questions. First, one, you have to avoid direct questions. What do you mean by direct questions? Which the patient has to answer in a yes or no. Are you thirsty? Do you like salt? So yes or no. You have to avoid that. You cannot give the patient that choosing between a yes or a no. Number two, you have to avoid questions putting answers into the patient's mouth. So, do you like greasy food? You don't like to greasy food, do you? You're putting you're thinking of pulsatilla, you don't like to greasy food, do you? So you're asking a question, putting the answer into the patient's mouth, which again is a leading question, which you should avoid. And thirdly, you should avoid question where the patient has to choose between two alternatives. Do you like dry or wet weather? Are your menses pale or scanty? Are you hot or chilly? So many times when you have to ask the question to choose between two different alternatives, that will also give you a false picture of the disease. Unsuitable mode of treatment will result. So obviously, when you're doing quick case taking, you may need to ask very precise questions, choosing between alternatives. When you're at the final stages, you are deciding between two remedies, then it's fine, to be honest, at the end. But initially, when you're starting off the case, you cannot be prejudiced and ask direct questions where you're asking in a yes or no. You cannot ask questions putting the answer in the patient's mouth where you're thinking about a remedy and you're asking the questions with some remedy in mind. You think of at me, you have problems in the sun, don't you? That's a direct question. You ask a patient where you have to choose between two different alternatives. Are your menses pale or scanty? Are you hot or chilly? Again, that will give you a false picture of the disease. So ask more broader questions. What kind of climate you like? What do you like to eat? Believe me, I used to always do that in the beginning, asking I used to do this mistakes, asking between, do you like sweet, sour, salty? Which one do you like more? What do you like to eat? Many times they will come up with a peculiar, I love to eat ice. You'll not ask that question very often. And you'll think of Medrhinum after that. What do you like to eat? I love to eat raw onion. Again, you won't think of that asking, but the patient mentions that. And many times when you're asking broader spectrum of questions, that will help you come up with a peculiar desire, peculiar symptom, which you perhaps wouldn't have got if you're limiting your questionnaire to a specific set of questions. So that's also very important. Pierre Schmidt, Art of Interrogation, never ask these three questions. And also to add to this, Dr. Bidwell mentions that there are three mistakes of a homeopath: asking direct questions, interrupting the patient, and asking questions with a remedy in mind. Never ever do that. Always keep your analysis at the end. Just have a conversation. Just try to find out what are the symptoms of the case. Do not ask questions with a remedy in mind. So, three mistakes which Bidwell mentions, GI Bidwell, that you should avoid: direct questions, interruption of the patient, and asking questions with a remedy in mind. So that's also quite important. 87 is all about leading questions. Do remember to not make that mistake.